I chose medicine as a career. I was always surrounded and exposed to medicine by my family. There was a physician, nurses, and technicians. And really, I was always the goofy kid who liked going to the doctor's office and was asking questions about what was happening there and what they were doing at the hospital with all those different people and machines. And as I got older, I realized that I really wanted to combine my interest and passion for science of medicine with anatomy, biology, as well as putting that together to solve complex problems and ultimately help patients. And I then chose surgery as a career because I liked the way that we could oftentimes offer definitive treatments for patients as a way to treat underlying conditions. For me, the most rewarding thing about being a provider is establishing relationships with patients. And this is actually one of the main reasons why I chose colorectal surgery as a subspecialty, is that it gives us a unique relationship and longevity with our patients. A lot of that is because oftentimes we're dealing with sensitive or private issues and chronic conditions that require a staged approach that is worked out between the provider and the patient and gives you an opportunity to really get to know them as a person. There's also, different circumstances we can meet patients. That can be in a screening scenario, like doing colonoscopy, that may discover a condition like inflammatory bowel disease or colon and rectal cancer that may require sometimes lifelong relationships and ongoing care. So I think the nature of these things really lends colorectal surgery as a way to develop these deep relationships, get to know our patients, their families, their lifestyle, what's important to them, and work together in a patient-provider decision-making approach. I'm often asked by patients, what should I be asking, or what's the right question in this scenario? And the way that I think about that and the way that I explain things is, I always want to know, if I was the patient, is what you're proposing as a treatment or a possible change in my life going to help me and treat what I care about and treat my symptoms? And that's really how I try to approach this with patients and explain to them, especially based in what we know about their condition, their relevant anatomy, and their workup so far, how, we can improve whatever their symptom is. I will admit that I am an absolutely terrible artist, but I use an awful lot of visual aids, models, looking at images with patients in terms of their things like CT scans and colonoscopies to really try to understand what the underlying problem or diagnosis is, and then how, by working together in what we may recommend, which oftentimes does include a procedure or surgical approach, how that's going to improve their quality of life. One thing about me, I am a born and raised New Jersey native, and I think that has certainly biased some of my interests, but on the weekends you'll certainly find me with my family down at the Jersey Shore. Summer or not, rain or shine, it's always our go-to destination. And then if not, we're pretty avid in terms of gardening and growing vegetables, and hopefully our daughter will continue to learn when vegetables are ripe and when they need more time to grow. I'm Dr. Andrew Morgan. My mission at Jefferson is to improve lives.